Right now at 6, an issue that we've covered extensively, the shortage of mental health providers.
It's a problem that hasn't gotten any better with time. WECT's Ariana Bertolotti speaking with mental health professionals tonight. Ariana, this is a problem that impacts just about every community.
Yeah, it does, Fran. There are only enough mental health providers to service a fraction of those in need, and it's even worse when looking at rural communities. Officials with Youth Villages, a nonprofit organization helping those with mental health challenges, say rural communities are critically underserved. Insurance barriers, education requirements, travel distances, and financial constraints all play a role in the lack of providers. In a 2024 study, the patient-to-provider ratio in some areas was as high as 5,000 to 1. The message from those on the front lines is clear. Rural communities deserve access to quality care. Those from Youth Villages say doing that will only come with fundamental change.
And removing access to care, removing barriers to access to care, like thinking about how we can utilize how advanced technology has gotten now with telemedicine, encouraging providers that have the opportunity to do that, and also the other side of removing barriers with community-based services too.
But it's not just rural areas that are struggling. Those in New Hanover County are feeling the same strain as well. Clinicians at MedNorth Healthcare say the lack of providers and mental health professionals is causing burnout amongst those on the front lines. MedNorth offers services to anyone who needs them, but that can range from a simple therapy session to more intensive care. And with supply not being able to meet demand, many who need help are left without it, causing a bigger issue down the road.
Without mental health support, our patients go into crisis. They are more unhealthy. They go to utilize the emergency room more, for care. And overall, it also puts our community at a safety, risk, right? That when people don't feel well, they don't act well.
If you're a mental health professional interested in serving the underserved, you can reach out to organizations like MedNorth that are actively recruiting for these positions. They say the growing community of care is key to turning the shortage around. Ariana Bertolotti, WECT News.